All right, good afternoon. Good afternoon. My name is John Fabazeski. I will be your MC for today. Most of you may know me by a different name, Johnny Fab, so give a shout out. Hello, my people. All right, all right. I am the, some time ago, I had a friend, and his name was Jesse Harvey. I met Jesse some years ago in Washington, D.C., and we were walking along the beach where the Awakening statue is. Now, the Awakening statue is a giant that is reaching out of the sand. And for the longest time, I thought of individuals with a substance use disorder as these giants. Jesse changed that perception when he said to me, "People that use drugs do not deserve to die." Can I get some cheers for that, please? Let me say that again. People that use drugs do not deserve to die. When I walked up the steps here today, I saw something to my left that you all can see in the concrete. It says, "Government is of divine origin, and any government is free where laws rule and the people are a party to those laws." Today, it's time to change those laws for the people that each and every one of these individuals behind us work with day in and day out. I am very grateful to be the MC here today, as this is a personal thing for me. Day in and day out, I am with these individuals in all of our communities across Pennsylvania trying to change. And it's time for change. Is it not time for change? Yes. It is time for change. Years ago, I was here for this very same rally when we were not ready for that change, but the time is now. And thank you to the effort of the Pennsylvania Harm Reduction Network for making this possible. And with that, I invite Carla Safransky to the stage.
Good afternoon, everybody. Can everyone hear me okay? All right, great. Welcome to the rally to legalize syringe service programs in Pennsylvania. This is a historic day for harm reduction and syringe services programs in Pennsylvania. Today, we are celebrating the pending introduction of bipartisan legislation to authorize syringe service programs statewide. We are celebrating the broadest level of support that SSPs has ever received. We have more than 125 organizations across the state standing up to support SSPs. We have more momentum than ever before. Today, we have a slate of amazing speakers from the Wolf administration, from the legislature, and from our amazing PA public health and harm reduction communities. And we have all of you. Thank you. Yeah. On behalf of the PA Harm Reduction Network and our amazing steering committee for this rally, I want to thank everyone who helped make this day possible. I want to thank my colleague, Brooke Feldman, who is also my best friend, mentor, guidance. I want to thank our speakers, Department of Health Secretary Allison Beam, Department of Drug and Alcohol Secretary Jennifer Smith, Physician General Denise Johnson, and our legislative supporters, Senators Patrick Brown, Anthony Williams, Representatives Ed Gainey and James Struzzi. And thank you to all of the advocates who came from across the state today to be here for the rally, including our speakers, Devea Van Cott, Clayton Ruley, Alice Bell, and Sarah Laurel, and our MC, Johnny Fab. Let's give them all a round of applause. People who use drugs and people with substance use disorders and people in recovery deserve dignity and respect. They deserve to live and they deserve to be healthy. Syringe service programs treat people with dignity and respect. They save lives and change lives. And that is what we are here fighting for today, to save lives. And now I will turn it back over to Johnny to introduce our speakers. Thanks everybody for all that you do.
All right, give it up again for Carla. Yes, really quickly, I just wanted to add, remember that awakening statue that I talked about just a minute ago? That awakening statue was not the individuals out there struggling. That awakening statue is the systems in which have kept them struggling. So today, that awakening statue has a new meaning for me. And I would like to bring up next State Representative James Struzzi.
Good afternoon, everyone. I appreciate everyone being here today, especially the people behind me. You know, today is about saving lives. Today is about helping people. Today is about humanity. All of us, at some point, have been affected by drug addiction. I personally, and many people know the story, lost my brother. It'll be 7 years ago here this November. And I know what that feels like. So that's why I am a big supporter of harm reduction. I learned about the Syringe services programs when I was invited by Representative Gainey to go to visit Prevention Point, Pittsburgh. I'm in Indiana County. It's a rural area, but you know, our rural areas have just as many, if not more, drug addiction issues than some of the urban areas. It's just that they don't make the headlines all the time. And that's truly unfortunate. And I think, you know, looking at this pandemic, drug addiction and overdose deaths have really taken a back seat to some of the other headlines when we're at a point now where overdoses are getting back to some of their highest points ever, and we have to stop that. And that's why harm reduction is so important. But what I really took from my visit to Pittsburgh and visiting Prevention Point was that it gets people in front of people. It gets people who care to talk with people who suffer from addiction and gives them an opportunity to seek help. And I think that is so fundamentally important. We know that the worst thing you can do to a human being is to isolate them. And so many people who suffer from addiction feel isolated. They feel like nobody cares, no one can help them. And that's why these services, to me, are so vitally important, because it connects people with people. People like all of you who care and want to make a difference in the lives of others. So I'm honored to co-sponsor the legislation that is in the House with Representative Ed Gainey on the Syringe Services Program. And we will be introducing that legislation possibly later today. And I'm also honored. I know that fentanyl makes a lot of headlines these days, and so I have introduced House Bill 1393 that would legalize fentanyl test strips for personal use. Thank you. And again, and I say to you, you know, I know what it feels like to lose a loved one. We can't help them if they're not here. And that's the bottom line for me, is let's do everything we can to help people get into recovery, to help them to get back to a quality of life that we all deserve in this country and in this state. And so I appreciate you all being here today, and I'm truly honored to help as much as I can in this fight to get people the help that they need through recovery services. So thank you all for all that you do. Thank you.
Thank you. Now I heard some change there, huh? Change! That's what we need to hear, that change language. To keep things going, it is my honor to introduce Senator Anthony H. Williams.
You are the quietest group of recovering people I've ever heard of in my entire life. So I'll do it again for myself. Anthony Hardy Williams. Please, you're too kind. Thank you. So I want the representative to come up here with me, because I want you all to understand that the message he delivered today was extraordinary. It wasn't visionary, it's timely. But be very clear, I've been in this chamber for several decades now, and I've never heard Democrat or Republican reflect upon the consequence and disease of addiction in the manner that you did today. So let us give him another round of applause, please. And I'm also going to tell you this. The grateful part is that the chamber is currently occupied by the majority party, which are Republicans. This gentleman, and I'm not calling D's or R's, right or wrong, we're going to need all parties to participate, but the majority party in particular has to be educated and sensitized. And so to have a leader with us here today, saying the words that you're saying and believing what you're saying, you're not doing it for political gain or rhetoric, you're doing it in a substantive way. We want to thank you for being so clear and clarion and in support of all the things we're going to do today. So thank you, my friend. Thank you. So I will tell you that the evolution of me on this issue has been a while. And I come from a community that was ravaged by drugs during the 70s when, frankly, the federal government allowed for heroin to be dropped in boatloads in neighborhoods across the country of black and brown people after the war who were addicted to heroin. And they did it without apology and, frankly, pretending like it wasn't existing. And so for generations, we've had a challenging issue with drugs within those communities, crack being the most prolific, which has destroyed families. And so when we start to have this conversation about how we deal with medical marijuana, recreational marijuana, syringe exchange, whatever it may be, in those conversations, it was challenging for me to have these conversations until a friend of mine actually stopped me, who was a recovering addict and a serious recovering addict for a long time, and talked to me about syringe exchange. And he said, let me be very clear. First of all, separate out the conversation about drug usage, and syringe exchange. The reality is the syringe exchange is not a drug. It doesn't promote drug addiction. What it does do is, frankly, as the representative said, allow for individuals to get in front of someone who knows something about drug addiction. So they have the possibility of recovery, of a job, of housing, of compassion, of a network that would support them as they go through recovery. So syringe exchange is much more significant than what people would think it to be, and that's a continuation of addiction. Frankly, it is the most interruptive process to addiction that many people will ever have if they have the opportunity to do it. The other thing I discovered was, and I thought it was legal, because we've had an exchange in Philadelphia for some time now, and I realized that was an exception to the rule as opposed to the norm, and that we have these places across Pennsylvania which put people at stake, breaking the law, trying to help people, going forward. And as I learned more, I realized how off course I was. But that being said, we have some work to do, my friends. A lot of work to do in this Capitol. This is a wonderful moment for us to begin to organize, and I'm so grateful that we have a gang of you all here. I hope you all are not that polite when you go in there. So when you go, how you doing? That's not what they need. They need you to stop them in their tracks so they begin to understand the consequences. I have had friends who consider themselves somewhat progressive who don't know a thing about syringe exchange. And their view of it is that we're talking about some issue of continuing form of drug addiction, and that's just not what the case is. So I'm so honored that you all are here today and supporting us who want to move this legislation. I'm so honored that you're giving us in Pennsylvania a chance for life for so many who are trapped in this struggle of drug addiction across the Commonwealth of Pennsylvania. I'm so proud that you all are here promoting what we know to be a safe and healthy lifestyle. I'm so grateful. I'm so grateful that not only we have representatives, but we have members of the administration. And understand something. The biggest dog in any fight in government in the state is the governor of Pennsylvania. And I want you to understand something. So to have the governor of Pennsylvania step forward into this space is something that I don't know any governor has done before. And most importantly, for this governor in his days as he's leaving to make this a priority is a major, major, major big deal. So I want to thank, yeah, that's right. Yeah, we're gonna certainly work on how you applaud people, because this is not going, that don't fly with me, okay? For those of you who know, I'm from Philadelphia, I'm an Eagles fan, and we are very rowdy human beings, okay? So did somebody boo Philadelphia? I mean, I don't care. Yeah, we'll do a little bit more noise. You want more noise? All right, can you do me the honor? I'm getting ready to leave. Can you do me the honor? And by the way, you may be a Steelers fan, an Eagles fan, but you sure as heck better not be a Cowboys fan. So let us go out. I want to go out with a big, gigantic applause for the governor, because let me tell you something, he's going to need it, and the people of the Capitol need it. So let us say, thank you, Governor Wolf!
I think that, Brooke, we should call a senator next time we need an MC for one of these things. It's got you a little pumped up more than I have. So I just want to take a second to say something that came out in the senator's speech was These individuals and individuals out there doing this work already are not doing it for personal gain, for recognition or office. They're doing it to make things better because it is the sensible, right thing to do. And with that, I would like to introduce Secretary of the Department of Drug and Alcohol Programs, Jennifer Smith.
Good afternoon, everyone. I am Jen Smith, Secretary for Pennsylvania's Department of Drug and Alcohol Programs. I want to say a huge thank you to the Pennsylvania Harm Reduction Network for asking me to join all of you, and an even bigger thank you to the folks standing behind me who have poured their heart and soul into getting where we are today. They've walked many, many miles and had many, many conversations with people to educate them about what this means and the benefits of programs in the harm reduction space. So the true heroes are these folks behind me that pound the pavement every day trying to educate people. So one more round of applause for the folks behind me. To everyone tuning in and everyone here in person who's been impacted by the disease of addiction, and to those who've lost a loved one as the result of an overdose, please know that I see you, I hear you. My thoughts are with you as you continue through your healing journey or on your journey through recovery. And to everyone who's answering the call to advocate for the expansion of life-saving services, thank you. Many of you represent a variety of backgrounds. You or a loved one may have lived experience with substance use. Maybe you're part of the medical community. Maybe you're a behavioral health or public health professional. Or maybe you're just an advocate for change. Whatever your background or profession, each of you play a vital role in addressing substance use disorder and doing your part to make a difference on someone's recovery journey. Recovery is based on community, creating a support system that's available to lift each other up. And each of us have a responsibility to be part of that support system for our fellow Pennsylvanians. And it starts with recognizing substance use disorder as a disease, not a moral failing. By showing compassion, we give people the courage to seek the help that they desperately deserve. Our role at the Department of Drug and Alcohol Programs extends well beyond our offices. We work closely with our sister agencies in the Wolf administration to allow for syringe service programs to operate in Pennsylvania. When someone's using drugs, oftentimes they're afraid to make use of services that can help them because of the stigma associated with this disease. This is especially true for folks who are members of the most stigmatized subsets of our population. The fear of discrimination, imprisonment, and overall shame are very real barriers for a person with substance use disorder who needs help. Harm reduction can be an important vehicle for reducing stigma, for reducing negative judgments and opinions of a person with substance use disorder. It encourages the belief in and respect for the person. Remember, at the center of all of these discussions is a person who deserves to be respected and not marginalized. The stigmatizing views of harm reduction itself imply that these strategies, quote, enable, unquote, people to use drugs. Boo is right. Do you know what harm reduction does enable? It enables people to keep themselves safer while they engage in behaviors that could be harmful. Yes. It enables reducing the transmission of HIV and hepatitis C. Yes. It enables people to be honest about their use of drugs or their harmful behaviors. Yes. Yes. And it enables them to see their own strengths and what they can achieve and be successful at. Yes. Yes. Strategies such as connecting people to healthcare services, clean needles and supplies, and engaging a person with substance use disorder into harm reduction programs are vitally important. We know that harm reduction can improve overall health outcomes, make drug use safer, and reduce drug use and/or lead to abstinence. In addition, the CDC reports that syringe service programs serve as a bridge to other health services, including hepatitis C and HIV testing and treatment, and medication-assisted treatment for opioid use disorder. A little over 18 months ago, the COVID-19 pandemic intersected with the opioid epidemic and the addiction crisis more broadly. Since that time, we've recognized that we need to look at our efforts in helping individuals with substance use disorder through a different lens. It's more vital than ever that we bridge the divides between mental health and substance use disorder. We must take a holistic approach when treating co-occurring disorders. COVID-19 has certainly taken its toll on everyone, including individuals in recovery and those actively using drugs. Through enacting harm reduction policy like syringe service programs, we can meet people who use drugs where they are and work to address their conditions of use. Prior to the pandemic, the Wolf administration made tremendous progress in lowering the overdose death rate by about 18% between 2017 and 2018. Today, we look back on 2020 and report the loss of more than 5,000 Pennsylvanians. And we're reminded of just how quickly circumstances can change. But the good news is that we can alter the course of that trend. Our ultimate vision is for all Pennsylvanians to live their best life, free or in recovery from addiction. By being here today, you are showing the strength in never giving up hope for another individual's wellness and transition into recovery. I encourage you to stay on these front steps and on these front lines. Having strong partnerships at the community and governmental levels will only help in getting appropriate harm reduction services enacted. Often in government, for organizations to work collaboratively, silos have to be broken. I would like to thank the Pennsylvania Harm Reduction Network for being a partner in this process, for being a partner that is helping to tear down those silos, as we continue on this shared mission and passion of connecting individuals to the proper treatment and resources, ultimately reducing the impact of substance use disorder in Pennsylvania. Thank you so much. Johnny, back to you.
Wow. Just encouraging words, right? Some years ago, get a little emotional just hearing our elected officials and other departments talking in a way that we've been talking for so long. For so long. Whew. I never thought in 1,000 years that I would be standing on the steps here at the Capitol introducing the Secretary of the Department of Health to talk about syringe service programs. So let's give it up for Allison Beam.
I never thought I'd be here either, so that makes two of us.
You're welcome.
Thank you. And I will not do any justice to Senator Williams' energy. Of course, that is football chants and the like, but I will share in his sentiments that it is such an honor to be with all of you today. Truly, we get a lot of opportunities to engage with folks, but the energy here today and the conviction that you're standing on these steps with is something that is palpable. And I am just so grateful for all of you and the work that you do day in and day out. It is not unnoticed. And on that note, that's why we get to be here today, because we are going to be able to see action, which is definitely something that I don't know we always get to see in this town or in this building. And so really, really grateful to be able to be here today with you all. As folks mentioned, I'm Allison Beam, Acting Secretary of Health. And I just honestly, as we continue our response to the COVID-19 pandemic, you know that this administration remains committed to the fight against substance use, including but not limited to opioids. We continue to have conversations and seek input to address barriers preventing access to that critical treatment that we've discussed. And we continue to look for areas to improve our response to the opioid epidemic. Today, we get to bring our attention to another area to improve. And we get to gather with all of you, advocates, public health professionals, program staff, family, and friends to support fellow Pennsylvanians on educating others on the positive impacts of expanding syringe services programs across our Commonwealth. It is such a pleasure to be here with you all today. When we talk about the opioid epidemic, we know, as Secretary Smith referenced, that too many lives are lost every year. And of course, as we've battled COVID-19, it has been even harder felt these past 2 years. Far too many spouses, too many children, brothers and sisters have left us too soon. And while we continue to fight two public health pandemics, we should use every single tool at our disposal to bring to that fight. And that is exactly what more syringe service programs would be for our residents, a powerful tool in the fight to overcome this health crisis. Expanding of syringe programs will first save thousands of lives and prevent untold numbers of HIV and hepatitis C infections. It will increase public safety and protect our law enforcement and our first responders by properly disposing of used syringes. As Secretary Smith already outlined, this is our opportunity to build bridges to drug treatment and other social services. And we will save taxpayer money by reducing the transmission of bloodborne diseases. And ultimately, it is going to reduce the overdose deaths and save families from suffering the loss that so many of us know all too well. Stand here with the legislation introduced and supported by our colleagues in the House and Senate here today, and I am proud to support it, as I hope you do too. I would like to close briefly by just sharing a quick message. You are not alone. Support is available. We are committed to having these conversations, seeking input, and addressing barriers to preventing access to all treatment. And we're looking for areas to improve. We're going to continue to fight this fight together. And again, so humbled to be here with you all today, and thank you for all that you do. Thanks again.
All right. So I was just checking in at the last break between speakers here, and I think the Pennsylvania Harm Reduction Network now has over 125 organizations statewide supporting. When I mentioned about being here today to the organization I work for, Pyramid Healthcare, they were like, it was a no-brainer. Where do we sign? Let's do it. And it is my honor and privilege to introduce next Pennsylvania Physician General Denise Johnson.
Well, good afternoon, everyone. Thank you so much, Secretary Smith, for inviting me. Thank you, Representative Struzzi, Senator Williams, and the passionate advocates here at the Pennsylvania Harm Reduction Network. Thank you. I'm so honored to be here to join you to talk about what we can do to move forward and save lives in Pennsylvania. It's been, after a year and a half, clear that Pennsylvania is struggling with addiction. Pennsylvanians struggling with addictions face far greater challenges because of the pandemic. Drug overdoses remain one of the greatest health crises facing our state, with drug overdoses increasing in 46 of our 67 counties in 2020. Our families and communities are being devastated by the loss of loved ones, and it doesn't have to be this way. In 2018, 4,424 people died from drug overdoses, and there were 4,458 people in 2019. Our reports so far from 2020, even though they're preliminary, are worrying with more than 5,060 deaths thus far. Pennsylvania has the third highest number of overdose deaths in the nation. And Secretary Smith and Acting Secretary Beam already covered about syringe service programs, that they would be a powerful tool in our toolbox to overcome this health crisis. But I also want to touch on how important fentanyl test strips are to the fight against this opioid epidemic.
Yes.
So fentanyl is a synthetic opioid that is 50 to 100 times more potent than morphine. And it's increasingly found in heroin and other drugs, including cocaine and methamphetamine. Many people consume fentanyl unknowingly, and it's because it's mixed with other drugs that they might be using. And the overdoses nationally involving fentanyl have quadrupled in recent years. Now there's a tool that can prevent these overdoses from fentanyl called fentanyl test strips. Fentanyl test strips are simple, they're inexpensive, and evidence-based method to prevent drug overdoses. Fentanyl test strips are small strips of paper that can detect fentanyl in any drug, even if it's pill, powder, or injectable form. Research has found that fentanyl test strips to be an important tool in reducing overdose deaths. Test strips cost about $1. And recently, the federal government announced that states can use this federal funding to purchase these test strips. Fentanyl test strips are used by just dipping the strip in some water that has a small amount of the drug that's added. And it can indicate the presence of fentanyl by the appearance of a red line on the strip. Pennsylvania's overdose deaths increased 14% in 2020. Again, with over 5,060 Pennsylvanians losing their lives to overdose. Research has shown that making fentanyl test strips available to people can be effective in helping to reduce these overdoses. Providing access to fentanyl test strips through public health providers and harm reduction programs also presents an opportunity to engage people who use drugs and offer them additional services, including drug treatment. In order to reduce overdose deaths, some states have begun legalizing, otherwise allowing the use of fentanyl test strips. And this includes Arizona, Maryland, Washington State, California, New Jersey, New York. You can see a diversity of states. So across the country, harm reduction and public health organizations are offering fentanyl test strips as one of our tools to fight and to reduce overdose deaths. In Pennsylvania, fentanyl test strips are considered drug paraphernalia under the Drug and Device Cosmetics Act. Despite this, some public health organizations have been quietly providing access to test strips to help reduce Pennsylvania's overdose death rate. 3 municipalities, Philadelphia, Pittsburgh, and Scranton, have recently authorized the use of test strips within their borders. But as is the case with syringe services, other municipalities and counties are unlikely to do that because it is not specifically allowed by the legislature through legislation. So legislation that has been introduced in the Pennsylvania House by Representative Struzzi and in the Senate by Senator Tim Kearney to legalize test strips is in force. So the Pennsylvania Department of Health supports this legislation. The time has come for Pennsylvania to expand syringe services and legalize fentanyl test strips across the Commonwealth. I am honored to be here to join you in this, and thank you for giving me the opportunity to help to save lives in Pennsylvania.
Thank you.
Thank you.
Thank you. Great remarks. Can we give it up again, please? I was just saying a second ago, it's hard to not be emotional today, right? Yes. It's really hard to not be emotional today while we wait for these things to be legalized, the continued work. I just wanted to recognize every person here and every person out there that continues to do these things despite the personal consequences of current legislation that might take on them. Because we show up and we do the work. And we do the work, we know what's right. And with that, I'd like to invite one of those workers, Dr. Divya Venkat from the Allegheny Health Network.
Good afternoon. I'm so excited to be with all of you here today. My name is Divya Venkat, and I am a physician from Pittsburgh, Pennsylvania. I am honored to speak to you today about a cause I feel strongly and passionately about. I've been fortunate to work with Prevention Point Pittsburgh over the last year as we created and implemented a mobile unit that focused on the treatment of opioid use disorder in a low-barrier setting. What has impacted me the most working with Prevention Point is not just the work, but the ways in which syringe service programs positively impact the lives of so many individuals. The participants we treat on the mobile unit are referrals from the Syringe Services program, and their stories teach me how to be a better and more compassionate provider every day. Frank is a 60-year-old man who was one of the first participants we were able to work with on the mobile unit. He had been injecting heroin for 40 years. During that time, he began visiting the Syringe Services program when it started. He visited the van frequently, collecting his supplies and learning more about safety and injection use. The majority of new hepatitis C cases are due to intravenous drug use, with the greatest increase in people under the age of 30. Syringe service programs are associated with approximately 50% reduction in HIV and hepatitis C incidence. 30 years of data has shown that SSPs significantly decrease the rate of transmission of viral illnesses such as HIV and hepatitis C. This model has been proven in cities like New York City and has been shown to be an effective intervention for persons who use drugs. Syringe service programs are proof that public health interventions can be effective in mitigating risks in specific populations. These programs reach people who are often hidden in plain sight, people that healthcare has failed time and time again, but who often utilize healthcare resources at much higher rates due to evolving illnesses like hepatitis C and endocarditis. Persons who participate in SSPs are 3 times as likely to reduce or discontinue intravenous use. SSPs not only provide vital resources, such as clean supplies that reduce infections and mitigate the consequences of intravenous drug use, like devastating infections, they also act as an unassuming, non-judgmental access point into healthcare. When Frank approached our mobile unit, he was looking down. He would not look me in the eyes, and he carried a heaviness in his shoulders. He spoke slowly and mumbled often. He teared up when he told me about his journey and what brought him to our van. He kept himself safe in all the years he used. He used clean needles from the Syringe Service program, and he did not share. But he was really tired. Before this moment, he had been afraid to approach any healthcare setting, knowing his past could be held against him. In this moment, he felt like he wanted to try buprenorphine naloxone as one last shot. Syringe service programs serve as a bridge and a connection to treatment programs and other healthcare services. Studies have shown that people who participate in SSPs are 5 times more likely to enter drug treatment and programs and 3 times more likely to stop using drugs. Many SSPs also offer referrals to treatment programs. Frank then returned sporadically for the next month. Each time, he described the difficulties he experienced in life outside our van. The overwhelming amounts of death he witnessed on a daily basis due to overdoses and the ever-changing drug supply. He said he was intermittently using to cope with these stressors. Each week, however, I saw him smile when he talked about giving out naloxone kits he received from the SSP. He beamed when he told me about the lives that he saved, when he had even lost hope in his own. Data has shown us that providing naloxone to active drug users is one of the most effective ways to prevent overdoses. Further data has revealed that SSPs reduce overdose deaths by providing and training persons to use naloxone in an overdose and keeping communities safer. Providing naloxone and meeting patients where they are in their use is one of the only effective ways to battle the new drugs that are killing thousands of people in our state. Preparing individuals for this by giving them access to supplies, creating pathways to engage in healthcare, and providing life-saving medications are the only ways that we can effectively create a new ending to the current opioid crisis. Frank has been with us on the van for 1 year now. He will soon reach his 1-year mark of being on buprenorphine naloxone and not experiencing an overdose. Frank now has a job and a home and is rebuilding his life around him. Syringe service programs not only improve our ability to see and understand drug use, but they provide people with a new way of life, no matter what that life may be. Thank you.
All right, have we lost any of that energy we started with? No! I don't think they can hear you up there. Yes, yes. And now, in keeping with the spirit of the individuals that get out there in the front lines every day and do this work, I'd like to introduce from Prevention Point, Philadelphia, Mr. Clayton Ruley.
Good afternoon, everyone. My name is Clayton Ruley. I'm the Director of Community Engagement and Volunteer Services at Prevention Point, Philadelphia. I've been at Prevention Point, Philadelphia for 13 years. Started as an intern when I was in grad school, and I've been hooked ever since. I'm hooked because we're practicing a meet people where they are philosophy in harm reduction. We understand that for a host of reasons, people are going to do certain risky behaviors, and we understand that that doesn't mean that it's a death sentence. We're not unrealistic around what happens when folks do certain activities, but we do whatever that we can to help people remain as safe as possible and stay around as long as possible, and that's a beautiful thing. That's why I've been at Prevention Point for as long as I've been. Syringe service programs are a part of a comprehensive harm reduction strategy, and this is a strategy that we need in Pennsylvania more than ever. This is what the country needs more than ever. This is what the world needs more than ever, and yet we see that Pennsylvania is way behind, and we need to get up and get to the times and do what's right by the folks that we work with and work for. I use those terms interchangeably. We work for our participants, we work for our co-workers, we work for our administrations and our boards at all the organizations that we work with, but we work with our participants, we work with our co-workers, we work with our administration and our boards, all interchangeably. So, don't forget that, the work that's being done on the ground should lead folks overwhelmingly to understand why there's this much passion today around making sure that syringe service programs get legalized in the state of Pennsylvania. When I got my first full-time job at Prevention Point, I was at acute medical care clinic. We call it Street Side Health Project program, where we worked with local universities, medical schools, and attendings and doctors to provide acute medical care. And knowing that that was going to save money, just like syringe services saves money. Cost of a syringe is 8 to 10 cents. Cost of someone contracting HIV, you're talking about 6 figures to 7 figures for a course of a lifetime of medication and treatment. We know that HIV is not the death sentence that it was in the late 80s and early 90s, but yet it's very expensive to treat and manage over a course of a lifetime, and people are living a lot longer. If we have a chance to make sure that folks don't contract disease, this is exactly what we should do. Please put down your morality around whether people should use drugs or not use drugs, and understand that for a host of reasons, people are doing these and other activities. We have a chance to save lives. We have a chance to save millions, if not billions of dollars for not just those individuals, but for us as taxpayers, all right? In Philadelphia, I always say that the cherry on top of the sundae to that argument was a recent study that was released by George Washington University. They did a 10-year study of syringe service programs, namely one in Philadelphia, Prevention Point, Philadelphia, and found out that 10,592 cases of HIV were avoided. Those 10,592 cases, when you consider that the cost of treatment and medication was going to be around $230,000, saved over a 10-year period $2.4 billion for the city of Philadelphia, and it saved about $240 million annually. So if you're saying that syringe service programs they encourage people being as healthy as possible, staying alive, and not having to receive treatment that not only hurts the individual paying for, but hurts all of us. This is why syringe service programs are needed. Prevention Point Philadelphia started at a time when the new cases of HIV attributed to people who were injecting drugs unsafely was around 48.5%. So almost in Philadelphia, almost 50% of the new cases were attributed to one category of people, and that was the intravenous drug using community using unsafely. Prevention Point opened its doors, and those numbers dropped significantly over the years to a low point of around 5.4% of the new cases of HIV being attributed to that category. And at the last time, the numbers were, low, 5.6% in 2016. And then in 2018, the numbers in Philadelphia went up to about 14.5%. That was a 115% increase from the previous 2 years' data. Why did that happen? That happened because of the presence of fentanyl in the drug supply. Fentanyl is 25 to 100 times stronger than an opioid pain pill or a bag of heroin, and yet it leaves your system quicker. So that means people who inject drugs have to use more syringes or contract HIV, hepatitis C, and also have to deal with a lot of wound care concerns. This is why it's more important now, more than ever, that syringe service programs are legalized in Pennsylvania. Yes. We need to keep people alive and keep people safe, and syringe service programs do that. I went from a program that was doing syringe services and acute medical care clinics and a little bit of case management to one that is the largest syringe service program in the country, and certainly one of the top 5 in the world because of its necessity. We do acute medical care, we do wound care clinics, we do HIV care, Hep C care, PrEP care, reproductive health care, overdose prevention trainings. We give out 20,000 overdose kits yearly in Philadelphia. And all that's because syringe services was allowed to be there and be that melting pot of all these services coming together. While it's possible to do some of these things, independent of syringe services, the fact that you're bringing people in to receive what they need to do what they're already going to do as safely as they can possibly do it means there's an opportunity to engage these folks and get them the help they need in so many other ways. It's going to help with housing. It's going to help with, medical services. It's going to help folks get their ID. It's going to help folks get back on their feet. And syringe service is a major piece to that. So we need syringe services as a part of our comprehensive harm reduction program. And we need not only syringe services to be legalized, but we need to keep the emphasis on people behind me doing the work to help syringe services stay alive and be right to the people that we work with and work for. It takes a dedicated group of people who are not just 9-to-5ers, but are passionate about helping people day, night, weekends, early mornings, whatever it takes. That's going to be the difference between us, making people better, not just for now, but for these coming days, and we need everything that we can get. So please consider supporting syringe service legalization throughout the state so that everyone can get some of the great benefits that we see legally in Philadelphia and in Pittsburgh and other places around the county that are around the state that are, doing things and risking, being locked up or being fined for distributing drug paraphernalia. It does not have to be that way. It shouldn't be that way. So let's get this legal so folks can come above ground and folks above ground can extend their services and make everything better for all those involved. And not only does it touch folks who use drugs and do other risky behaviors or behaviors with risk, it helps the overall community to have everyone everyone as well as possible. Let's make it happen. Let's get syringe services legal. Thank you, and have a good one.
Thank you, Clayton. And staying with the spirit of those doing the work, it's my privilege to introduce Alice Bell from Prevention Point, Pittsburgh.
So I'm Alice Bell. I work for Prevention Point Pittsburgh. I'm the Overdose Prevention Project Director. Thank you. So I coordinate all the naloxone distribution, and I give out naloxone every Sunday at one of our syringe service sites. That's the best part of my job. Prevention Point started providing safer drug use equipment to people in Allegheny County in 1995 to prevent the growing spread of HIV and hepatitis C. It was started by a couple of people, James Crow and Carolyn Acker, who just set up a card table on a street corner. In 2001, syringe distribution was legally authorized on an emergency basis by our County Board of Health. And in 2008, a county ordinance was passed to legally authorize the practice of safer supply distribution. While this has allowed us to be public about our services and we've been able to expand our services, we still have to go through a complicated and time-consuming process to provide services in any new location. And even though it's legal in Allegheny County, we've yet to get authorization to have a syringe site anywhere outside of the Pittsburgh city limits in Allegheny County. You know what the data shows. You've heard it repeatedly today. Decades of research at this point demonstrating that access to syringe service programs reduce the spread of HIV, hepatitis C, prevent other bloodborne infections like endocarditis, and that the cost savings are immense. But the bottom line is really common sense. Every single time someone uses a sterile syringe, they're not getting or spreading a bloodborne infection. Just like every time you wash your hands, you're not getting or spreading hepatitis A or other infections. Prevention Point has given out over 1 million syringes already this year. That's 1 million times that someone did not get hepatitis. Having local legal protection allowed Prevention Point to be public, to get funding, to expand our services. We've added case management services to help connect people to treatment, wound care services, mobile van sites, such as the medical van that Dr. Venkat talked about and works hard at, and overdose prevention services. In 2005, we started distributing naloxone to prevent overdose deaths. Since then, we've distributed naloxone to over 10,000 people and documented close to 5,000 overdose reversals with naloxone people have gotten from us. While many people now carry naloxone, police, social workers, probation officers, the most likely person to be there when someone overdoses is the person who's using drugs with them. 90% of the overdose reversals we've documented are accomplished by people who use drugs, saving the lives of their friends and family members. Syringe service programs are well established as the #1 most effective way to reach people who are most likely to be there and use naloxone to save someone you love when they overdose. Last year, in the middle of the pandemic, we distributed close to 9,000 doses of naloxone and documented reports of almost 9,000 overdose rescues. We had over 5,000 interactions with people who got safer drug use supplies. We added new projects, the mobile medical van to prescribe Suboxone, where we see about 70 new people a month, and our statewide mailing project, which has mailed over 14,000 doses of naloxone to people around the state who would otherwise not have access. Jamie Favaro, who's the director of the National Naloxone Mailing Project and also oversees mailing of other harm reduction supplies in states where it's legal, is also here today to support us. Shout out to her. Our local legal protection has serious limitations, the most obvious being that it's local and most people in the state have no access at all. While Prevention Point provides supplies to anyone who requests our services, there's no protection outside of Allegheny County, and there's no protection for people who use our services. The only protection that the ordinance provides is for those of us who provide the service, which means that people could leave our program and get arrested for getting the supplies. So people who access our services and are working hard to prevent the spread of bloodborne infections in their communities continue to be at risk of arrest at the whim of any law enforcement officer. Last week, someone came to one of our sites to get naloxone and talked to me and said that he started coming to Prevention Point over 10 years ago. He said, if it wasn't for you, for Prevention Point, I know I would have HIV and hepatitis C, and I don't know if I'd be alive if it wasn't for you all doing what you do. A woman told me that her daughter has been in and out of chaotic drug use over the years, and when she first found supplies that her daughter had gotten from Prevention Point in her room, she threw them away. Then she realized that this was actually protecting her daughter's health. She said that when there had been times over the years when her daughter was out on the street and she didn't know how to reach her, she took comfort in knowing that her daughter had us, that she had the connection with us and knew where she could get help when she needed it. So we hear a lot of stories of appreciation, but probably the thing that we hear most often, which is really rather disturbing, is people saying, you don't know what it means to come someplace where you get treated like a person, with respect. This is the only place I feel this way. You have no idea what it feels like. That's a crime. In 2021, it makes no sense whatsoever for it to be illegal to be in possession of the tools to protect your health, like a sterile syringe, like drug checking equipment such as a fentanyl test strip, or your own pipe to keep yourself safe from COVID. It's time we made these life-saving tools available to all Pennsylvanians. Thank you.
Thank you, Clayton and Alice, for those words. You know, I was looking around behind me and I saw things like save lives, legalize. Every overdose death is a policy failure.
Yes.
Dead people can't recover. Yes. Some might say that those are savage statements. I say they're truth. They're absolutely true. And I couldn't think of a better way to introduce our next speaker from the Savage Sisters in Recovery, Sarah Laurel.
Can I pull this down a little? Cool. My name is Sarah Laurel. I am the founder and executive director of Savage Sisters nonprofit. We offer safe, structured, trauma-informed housing, street-based outreach, and harm reduction trainings throughout the state. Our mission is attacking addiction ferociously with radical love through connection. I hold many titles and identities. Some labels I'm very proud of. Others were painfully given, but they're also slightly accurate. I've been labeled, numbered, and branded. Genius IQ, stupid junkie. Fierce feminist, man-hating whore. Present parent, bad mother. Hep C patient, Hep C survivor. Community advocate, inmate. Hopeless cause, empowered female. And my favorite, Sarah the Savage. I've learned that each of these labels has deeper roots. Each one is entangled in my not fully formed tree of life. Each identity came with its own set of memories and experiences. But today, I will be talking about why I personally identify as a harm reductionist. I learned very on that working in harm reduction would mean calling on my lived experiences to be of maximum service to others. That I would need to be transparent about my journey because it is my strongest asset. Harm reduction is resources for individuals that are offered for legal and illegal behaviors. To me, it's a sandwich, a warm pair of socks, safe syringe programs, access to naloxone. It's listening without judgment. I lost my spot, guys. And loving unapologetically. It's me, sweaty, smelly, homeless, addicted, and starving, but receiving a warm hug from a human that has no expectations. That is harm reduction. That is radical love. I was a recipient of harm reduction during my active addiction, and it kept me safe. At a certain point, I was out in the counties, not Philadelphia, where harm reduction was neither offered nor discussed. I found myself with a choice one day: share a syringe or become violently ill. Safety was not one of my options. Both of the choices were dangerous for me. I contracted hepatitis C that day. Years later, when I got diagnosed, I was able to receive access to the cure through Prevention Point. I've reflected on my addiction and recovery journey and started seeing a pattern. I was handed my first prescription behind closed doors. I hid behind closed doors to use drugs. I was told, don't talk about that, that's private. So I started changing that narrative. Abstinence-based teaching imprints in our minds that drug use, sexual behavior, and mental health issues must be kept private, which would explain why 7 out of 10 overdose deaths happen in a home, behind closed doors. My efforts today are brazen, loud, and some would say irritating at times, but they are real. These are my truths. This is what your fellow American has endured. My experiences are authentic. And in this space of no longer engaging in hide and seek with my community and the government, we empower this message. Yes. So, I tell my story no longer silenced by shame or held captive by my prisoner tongue. I will loudly, consistently, and coherently advocate for safety. Create a safer environment for our citizens. Support safe syringe programs. Lower the number of fatal overdoses. Increase the chance to connect and offer real resources for recovery. Help lower the rapid rate that infectious diseases are spreading, and smash the stigma surrounding it. When I worked in corporate sales, I did an extensive training with my regional manager. One thing I remember her telling me is, Sarah, the only objection you cannot overcome is safety. I'm going to repeat that today. The only objection you cannot overcome is safety. In conclusion, I have 2 messages. To my beautiful friends in need of harm reduction, you are not alone. There are thousands of individuals fighting for you and your human rights, from the streets of Kensington to the steps of this Capitol. We will not fail you, and we will not stop. We will march, rally, speak, and serve you ferociously until real change happens. So stay strong, my friends. To our lawmakers, I challenge you. How do you justify denying safety to your citizens? That's right. Thank you, stay safe, and stay savage. Yeah!
I knew that was going to be savage. I just knew it was. I asked the Savage Sisters to do a TikTok a while ago, and they were like, no. So I immediately closed off to that. But let's give it up for everyone that has been speaking here today, from our legislators to our volunteers to the organizers. I would just once again like to reflect back to that statue, the Awakening statue. And if you haven't seen it before, do a quick Google. You'll see what I mean by it. And I think that today we have seen an awakening. Yes. We have seen a new way of doing things and a dedication to that to happen. And I just want to, before I bring up our final speaker to do so, I just wanted to take a moment of personal reflection to speak. You're all here so you can hear it, but it's to her. some years ago, I couldn't find my way in advocacy and didn't know what I was doing here. And I met a person named Brooke Feldman who came and spoke to a few of us. And some people got the message, but she drove it home for me. I struggle a lot, and we lose a lot of people every day, and we sometimes get so far down in the darkness that we need certain individuals to reach out to do so. So I just wanted to personally thank her and for allowing me to be the MC today, because this means so much to me, and it means so much to so many other people. But without further ado, and our closing, the co-founder of the Harm Reduction Network, Brooke Feldman.
I must have angered Johnny at some stage of life for him to make me cry before I got to stand here in front of all you. But thankfully, I only have the job of wrapping us up, and I don't have much to say after what our speaker said. I think you heard the urgency, right? There's an urgency. I can tell you, as someone who has done advocacy for, I just turned 40, which I'm working through, but it's been about 16 or 17 years that I have spent 16 or 17 years being told that my sense of urgency is problematic. Like that, what do you mean you want it to happen now, Brooke? That's not how it works. But I know that it's not how it works either, that I am at a funeral more often than any human being should ever be at a funeral. Yes. For preventable deaths. Right? We're talking about preventable deaths. Nobody has to die from opioid-related overdose death in Pennsylvania ever. We're talking about preventable disease. Nobody has to contract HIV or AIDS in Pennsylvania ever. And so for me, urgency is that I am tired of getting phone calls about the next person who died. And I know that the people behind me are also tired and fed up of getting phone calls about the next person who died, especially when some of the people behind me, the next person who died came out of their body. Came out of their body, their child, who did not have to die. So the urgency is real. This is not the first rodeo with let's legalize evidence-based public health interventions that have been so well studied that you can't even say they don't work. You just have to say, I hate people who use drugs. Because that's all it is I hate people who use drugs. And we ain't even mad at those people who hate us, right? Because we were taught that. We were indoctrinated to that. I grew up with McGruff the Crime Dog and the DARE program. And I was taught to hate people like my mom, people who use drugs. And when my mom died from an opioid-related overdose death, before most of the folks in this building even cared about us, those of us who use drugs, I was taught that people who use drugs are bad people doing bad things. And so the only reason why the folks in the building behind us would have any reason to not get this legislation introduced, and let's move it forward. The only reason not to is because you hate people who use drugs. But the only reason that you hate people who use drugs is because you were taught to. And so we're not going anywhere. This was the beginning of what is going to be a very, very, very urgent push to legalize public health in Pennsylvania. And this is the last thing, because I wasn't even going to talk for real. Like, I think everyone hears Brooke Feldman's mouth enough. But what I want to say is this. We know we need to legalize syringe service programs. I mean, I can't believe that I'm still up here talking about syringe service programs. Honestly, I want to be up here talking about safe supply, right? And I know we're not there yet, and my keepers will be like, Brooke, why'd you go there? But because for me, this is a Band-Aid, right? And so all right, let's get the Band-Aids, because I want to get to the real solutions. None of us have to die. I don't have to get that phone call of the next funeral, or sit there with a mom who you could feel the pain. We're all carrying that pain. It's urgent. What I wanted to say, though, which was I'm going to say this and shut up, which for those of us who have been in the recovery community, means 5 more minutes. But I'm not going to do that to Carla today. What has been, so I've had the pleasure of the past 6 months of getting to, mostly through Zoom, run around Pennsylvania, but also in my car a little bit, and get to meet just the most amazing, extraordinary people that nobody ever heard of. that you don't know. They're not on Twitter like Brooke M. Feldman, like just screaming about the latest outrage. They're not on Facebook, you know, taking selfies about, look at all the food I gave out in Kensington today. Aren't I amazing? They're not like looking for the awards or the titles, and they could really give Carl Emmons did it. They don't care about the money. They don't care about the money. They don't care about the power. They don't care if you know that they do it. They do it out of love. Love. And that's what we're talking about here. And I'm a social worker, right? And it's like in social work, we're not supposed to talk about love. I have to use like a clinical name for it. It's love. It is love for our fellow human beings, for our neighbors, our children, our friends, our coworkers. Like, it's just love, right? And I've gotten to meet the most amazing Pennsylvanians. Many of them are who are behind me, but I'll tell you what, the most amazing ones, they're not here today. You know why they're not here? Why are the most, and not that you aren't amazing, you are amazing, I love you, and I almost knocked there at the podium. But why isn't this a big crowd? Where are the rest of the people at right now? What are they doing?
They're doing the work.
They're doing the work. They're doing the work. We're so busy trying to stop our friends from dying that we don't have the time to come to this stuff. None of us want to be here. This is all is a show for us, right? But we need to do it to make the legislation move and to get our friends to stop dying. So these are the people, these are the real ones. Like, if you want to find a Pennsylvanian who's going to love you no matter what choices you make with your life, no matter if it's the 20th time you did something you said you didn't want to do, we're going to love you till the 21st. And then until the 50th. It took me probably 200 times of someone loving me despite me making choices that looked like I didn't love myself, because you know what? I didn't. I was taught not to, but the love of others is what kept me going. So please support Pennsylvanians loving one another. And then, honestly, this is the last thing, and I'll be quiet. I think, let's just be real, right? This is where Brooke goes off the record. I promise, Roseanne, I'm going to be good, though. The elephant in the room, we had a statewide harm reduction advocacy organization, and then that went away. And there was harm done, and there was great work done. And we need to talk about the great work, too, not just the harm, but there was harm, and we need to talk about that, too. And, you know, for me, what was super important when an opportunity came to have a statewide harm reduction advocacy organization is that we didn't repeat the same mistakes, because we can't afford to. Because while we're waiting for government to move, like, quick enough that we could maybe possibly prevent a death, we're out there trying to, like, you know, we need to be out there preventing deaths ourselves. And so the last thing we needed was like another sort of statewide, you know, organization that was going to repeat past mistakes. And we don't need elected officials doing it either. And we don't need appointed officials doing it either. Let's stop repeating past mistakes. And so for me, one of the past mistakes is it goes back to the real ones are the ones you never heard of. The people you don't know, the people that you have no idea who they are, that if you were to look at the list of speakers for an event like this, you'd be like, who is that? Like, why would I go to that? I don't even know those people. Those are the real ones, though. And for the Pennsylvania Harm Reduction Network, is going to be all about the real ones. We don't care about the awards or fame or power, whatever. It's going to be about the real ones having access to the resources they need to do what they've been doing all along, what people are out here doing all along, on their own time and on their own dime, just trying to save lives. And so I look forward to, Clayton didn't know I was going to put him out there like that either, but you know, pretty soon we're going to have a transition where the Pennsylvania Harm Reduction Network is going to be led by Carla Safransky, who made everything happen today with the support of volunteers. Carla is a real one. You maybe never heard of Carla Safransky before all this hoopla, but Carla's been doing the damn thing for a very long time. And then also Clayton Ruley. Another real one. And so whoever needs to hear this, I hope you hear this. The folks like Clayton and Carla, those are the people to listen to. The people you haven't heard of. The people who aren't doing it because they want some kind of medal. The people who aren't on these stairs right now because they want to be in a photo op. They're here because we have to come all the way to Harrisburg to ask our lawmakers to, as Sarah said, to keep us safe. Like, there is, I'm getting myself hyped again, but like government has like some pretty like basic like jobs, right? Like, and it's to ensure that like our civic lives have things like safety, right? That there's like sanitation, that, you know, we don't live in a community that is covered in litter like in Kensington where most of my work is done. Like, government has some like just basic responsibilities, but keeping us safe is absolutely one of them. And so the real ones are out there keeping everyone safe while government fails to do its job. but some of them came here today, and I love you all for it. And Carla and Clayton are two of the real ones who've been doing this for so long. Maybe you never heard of them, but you're going to know who they are, and not because you're going to start to see them everywhere, but because now you know that they're two of the real ones who are going to lead the amazing people that are across the entire state to come together. We're not going anywhere. This is the first. We're going to be like on folks in this building because we're not going anywhere. We're going to organize, get even more powerful, and we're going to demand that we just have what it is we need to stop going to funerals and burying our friends and family. So thank you very much. I love you all for coming. That's a wrap.